So our topic today is PIAs, and that is called pregnancy-induced hypertension. And from name we can understand that this type of hypertension happen due to pregnancy. That's why this is called pregnancy-induced hypertension. So suppose a pregnant female comes to you as her first follow-up at her 12 weeks of pregnancy, and you check her BP, and you have found that her BP is 150 by 90, and at 12 weeks he comes. So she so is that called pregnancy induced hypertension? No, that is not called pregnancy induced hypertension. So what is the definition of pregnancy induced hypertension? That pregnant female had no past history of hypertension, or no previous history of hypertension, and after 20 weeks of pregnancy this BP is more than equal 140 by 90, and not in single occasion, in two occasions at 4 hours interval. Okay, that patient is called pregnancy induced hypertension. So a pregnant female, she had no past history of hypertension. Number 2 is after 12 weeks of pregnancy her BP is more than 140 by 90, more than equal 140 by 90 at two occasions at 4 hours interval. So suppose you measure her BP at 4 p.m. and her BP is 150 by 90, and after 4 hours at 8 p.m. you measure her BP is 144 by 94. So you can call that patient, this patient is pregnancy induced hypertension. Okay, there is one thing, that after 12 weeks of delivery, her BP becomes normal. Okay, so and after that we classified this PI's, pregnancy induced hypertension, in two types. Number 1, preeclampsia, and number 2, eclampsia. Preeclampsia is that a female pregnant patient after 20 weeks of pregnancy, her BP becomes more than equal 140 by 90. That is called preeclampsia. And if this preeclampsia patient experienced convulsion, that is called eclampsia. So we can say that preeclampsia plus convulsion equal to eclampsia. Okay, and further this preeclampsia classified in two types. Number 1, mild preeclampsia. Number 2, severe preeclampsia. So this preeclampsia is classified in two types according to the severity. Number 1, mild preeclampsia, and number 2, severe preeclampsia. What is mild preeclampsia? The BP is more than equal 140 by 90 but less than 160 by 100. So BP is more than equal 140 by 90 but less than 160 by 100. That patient is called mild preeclampsia, and there is no sign of end organ damage. Okay, and severe preeclampsia, obviously BP more than equal 160 by 110 and signs of end organ damage is present. That is called severe preeclampsia. So what are the signs of end organ damage? Signs of end organ damage is creatinine. Number 1, creatinine. End organ, there is various types of end organ, brain, kidney, heart, those are called end organ. So if creatinine level more than 1.1, platelet count less than 1 lakh, liver enzymes all are raised except ALP. Why ALP? Because ALP is normally raised in pregnancy, that's why ALP is excluded. And number 1, 2, 3, 4 pulmonary edema present, and number 5 visual symptoms. Visual symptoms like blurring of vision plus irreversible blindness, then scotoma, those are present, and that if present, those are called end organ damage. And there are one thing you have to remember, that proteinuria. If the amount of protein in urine is more than equal 300 milligram in 24 hours, okay, 24 hours, that is called proteinuria. So if the end organ damage is present and the BP is more than equal 160/100, that is called severe preeclampsia. Okay, so our topic is completed. Pregnancy-induced hypertension definition, types, and end organ damage. Okay, in next class we will discuss the pathogenesis of this pregnancy-induced hypertension.